Hello, internets. This is Mark from LARVOL, and this is our Friday Onco Data Podcast, the pre-ASCO series edition. So join us here every Friday. To reintroduce myself, Mark Gramling, a VP of Oncology at LARVOL, joined here with my colleague Judith Pérez, who's Associate Director in Bioinformatics, and we're part of the team that works on the CLIN platform, which is covers clinical trial data, digitizes outcomes from those clinical trials, and also a big element is looking at social media for the leading voices in oncology, oncologists from around the world, and how they react to publications and data releases. And I introduced that particular aspect specifically because we have Dr. Amol Akhade, one of our top voices, our top influencers on said CLIN platform, joining us today to be discussing some of the expected exciting data that'll be coming from ASCO, especially maybe today starting out with a focus on lung. But first, I'd like to pitch it to Dr. Amol to introduce himself, and we'll get the conversation going from there.
So thanks, Mark, and thanks, Judith, for having me here. And I hope it's a pleasant morning at your side. And I'm Dr. Amol Akhade. I'm a medical oncologist practicing in Mumbai, which is in India. And I'm practicing medical oncology for the last almost 14 years. I look into predominantly solid tumors, that is lung cancer, breast cancer, head and neck cancers. And as Mark said, I like to be active on Twitter, or which is formerly called as X, to have an interaction with my fellow oncologists all over the world regarding the oncology data, which is presented in various conferences or in journals, and to have a discussion about it so that I can learn from everybody else and I can keep my.
Excellent. Appreciate that, Dr. Amol. So as we usually do, we like to sort of reintroduce the CLIN platform, and maybe we'll just drill down into a couple select trials. So I'll let my colleague Judith share the screen. So let's pull up where ASCO tweets are, to be put it in the most simplistic way. So this is, yep. Well, I have to give the broad introduction for my baby here that I built with a team. So this is CLIN, and you can actually do a preview version of CLIN. You can just find us at clin.larvol.com. And obviously, if you're interested in the full version of CLIN, which we're demoing today, reach us on social media or reach out to us via larvol.com, our company website. So what Judith is going to do now is click over to the conferences tab, and we cover about 130 or so around the world through the year. And we're going to just go ahead and click on ASCO 2024. Of course, the data is still forthcoming, but people are preparing and showing how excited they are in many cases about forthcoming data. And so we'll click through this. I think we might have lost Dr. Amol's connection, but we'll give him a second to rejoin. So here we're looking at, well, I've been talking too much, so let me let Judith run just super quickly through the analytics, and then we'll keep going from there.
Okay, yes. So in here we're looking at some analytics associated to those abstracts titles right now that have been released for this ASCO, and who and what are they talking about. So the abstracts, we can see them, the top trials in here, and how much people is talking about them in terms of tweets. So as Mark said, we follow more than 2,000 DOLs, and they can talk about these abstracts with some sentiment, like having mentioned on positive practice changing, or maybe positive impact of those trials releases. And in here, that's what you can see. So the number of tweets along with this sentiment analysis, which is half AI and also curated. And we have these analytics both based on top trials, as well as these top influencers that we are following. We can see there we also have Dr. Amol Akhade that is joining us today. Then we have also top companies. And finally, we have also a more complex heat map where we can see those trials along with the influencers that have been talking about them and the number of tweets that have been posted on those topics.
Excellent. And I think, well, first off, can we, screen's pretty small for me. How's Dr. Amol doing on our top list?
Okay, check it out. Yes, if I'm not mistaken, this is his handle.
I'm not trying to embarrass you, Dr. Amol. I just want to see how you're doing in the rankings, and it appears your volume's pretty solid relative to the CLIN community. So that's excellent. Maybe you can climb to the top if you exercise your Twitter thumbs. But yeah, so let's go back and maybe, and I hope your connection's good, Dr. Amol. I saw you were able to rejoin. We were just going through the analytics. I think too that we had discussed prior, obviously in the context of lung would be the LAURA and Adriatic trials, and you can see within even the pre-data release social media activity, they're quite high on the list. So why me talk when I have an expert here? Maybe Dr. Amol, for those two as a starting point, and maybe as Dr. Amol tells us a little bit about what he's looking forward to in those trials, you could click through Judith and show some of those tweets. So Dr. Amol, back to you.
So yes, ASCO 24 is coming up in the month of May, and ASCO is in the first week of June. So everybody, all the oncologists all over the world are looking forward to the exciting data which will be presented in ASCO 24. But more so this time, there's a lot of exciting data about lung cancer which is coming up. And that's why some of us are saying on the internet and Twitter that actually it is an ASCO lung rather than ASCO 24, because there is a lot of lung data which will be presented. So as we have previously pointed out, there will be two prominent trials. One is LAURA and another is Adriatic, and both are will be presented as a plenary presentations. And these are very important trials, and they are potentially practice changing all over the world as far as the lung cancer treatment is concerned. So let me help you to go through both these trials. So we'll start with the LAURA trial. LAURA is basically an early stage non-small cell lung cancer trial, and in which they have taken phase 3 patients, and they're generally not resectable, so they're subjected to chemotherapy and radiation. And after that, especially those who are EGFR mutated, they're taken in this particular trial, and they will be given on the control arm with placebo, and on a trial arm they'll be given osimertinib, which is an active anti-EGFR drug, and it will be given till progression or toxicity. And what they wanted to show is that whether that improves the outcome of the stage 3B patients. If you see, my oncology colleagues must be knowing that stage 3B patients, which are non-EGFR mutated, generally are treated with chemotherapy and radiation, and followed by maintenance durvalumab, which is the standard of care based upon the Pacific trial. And now we have this exciting trial called as LAURA trial, in which EGFR mutated patients of stage 3B will be given chemotherapy and radiation, and those who are responding, that means those who are showing stable disease or partial response, or those who are not progressing, they will be subjected to a maintenance therapy with osimertinib. Now, osimertinib is a very good TKI, oral TKI, and it has been already approved for metastatic non-small cell lung cancer. It is already approved as an adjuvant therapy for up to stage 3A based upon the previous trial, that is ADAURA trial, which was presented a few years back in ASCO. So LAURA is just an extension of that. So there is already a press release about LAURA trial, and it has been declared that there is a significant PFS benefit, which we expect because osimertinib is a very good drug. What I will be interested to see, what is the magnitude of the benefit? What is the hazard ratio of the benefit? Because in Adura trial, we had hazard ratio as low as 0.27 to 0.3. So whether LAURA trial will have that much significant hazard ratio benefit for PFS, that I'll be looking forward. Of course, I would like to see whether the OS data is matured and whether the overall survival is shown in this particular trial or not. And another important point that I would like to see is, like, this is an adjuvant trial basically. So whether the control arm patients eventually are going to get osimertinib on progression, what is the crossover percentage, whether we are basically trying to answer a question whether giving osimertinib early versus giving it late is making a difference. And then it will be interesting to see whether what is the crossover and how many patients on control arm on progression gets osimertinib. And another point is sometimes those patients who have got osimertinib after chemoradiation, they end up getting pneumonitis. So what is the toxicity of giving the osimertinib early? So these are some of the points that I will like to look forward in the LAURA trial. I'm sure probably this will have a good PFS effect, but I'll be excited to see what is the magnitude of benefit and whether it is showing a trend towards OS. I don't know whether OS data will mature, but if they show a good enough trend, then I think this will be a really practice-changing trial. So that is one thing about the LAURA trial. The other trial that is again another exciting trial is the ADRIATIC trial, which is about small cell lung cancer limited stage. As you all know, that small cell lung cancer is an aggressive disease. The outcomes are not great, even though it is a limited stage disease. The outcomes are not good. And in this particular trial, again, what they have done is that they have given chemoradiation to the limited stage small cell lung cancer patients, and they have given them on the trial arm maintenance of durvalumab versus a control arm of placebo. Again, if you see, durvalumab is already approved for extensive stage small cell lung cancer by Caspian trial. It is approved for last 3-4 years. So again, as I told in LAURA trial, in this trial also, we are trying to give a drug which is already approved in an advanced setting to a limited stage setting, early stage setting, and see whether that is going to improve the progression-free survival and overall survival. Again, ADRIATIC trial also has a press release, and it has said that it is a very good PFS benefit. So again, we like to see the same things, the magnitude of the benefit, what is the hazard ratio of benefit, is there any trend towards OS, and of course the toxicity part, and of course we like to see what is the crossover, whether the control arm has got enough of durvalumab on progression. So these are the things again I like to see in the ADRIATIC trial, and the data will be out I think a few hours before the plenary presentation because of late breaking abstracts. And once it is out, we'll again have a discussion on how good the data is. But I personally feel both these are going to be a really practice-changing trial, especially in part of the world where the accessibility to the drugs like osimertinib and durvalumab is not an issue. So this is about the two main trials. And as I said, there is a lot of other exciting data also coming up in ASCO 24 about the lung cancer. One of the trial is BEAT-MESO trial, in which for a disease called a mesothelioma, in which current standard of care is to give chemotherapy along with bevacizumab. So in this trial, they have tried to see whether addition of atezolizumab, that is an immunotherapy drug, makes a difference and improves survival or not. Mesothelioma, advanced mesothelioma, especially the advanced stage, are a bad disease to have, and they have dismal prognosis. So they like to see whether by addition of atezolizumab improves any progression survival or maybe overall survival in this particular subset of patients. So that is another trial. Again, one of the trial is sacituzumab govitecan used in non-small cell lung cancer in second-line setting, and they are compared with docetaxel. Now, that is called the EVOKE-2 trial. There is a data released about this trial, and the trial is supposed to be negative, unfortunately, but we like to see the granularity of the data to see whether there is a certain subset in which this particular drug is showing any benefit over the docetaxel in the second line in non-small cell lung cancer. And there will be some exciting updates about the neoadjuvant durvalumab trial in early stage lung cancer. Then there will be update about the CROWN trial, the 5-year update data. Also, there is a trial about subcutaneous versus IV amivantamab in exon 20 in certain patients. So these are the exciting data that is coming up. And that is what I said, that this ASCO is probably ASCO lung, and thoracic oncologists and those who treat predominantly lung cancers all over the world will be looking forward to this data and to have an exciting discussion on X and various other platforms.
Well, thank you, Dr. Amol. I think we've realized when we get into this level of data and someone at your level of sophistication, there's an intrinsic flaw of trying to do a 15-minute podcast, so we may have to correct that later. So I just want to thank you again for joining us for now. I guess I'm supposed to call it our pre-ASCO lung series, or the conference being ASCO lung. So definitely, like I said, find us, reach out to us on social media or through a website if you're interested more in CLIN.
Definitely.
And if maybe you either go through CLIN, you can actually see it as a preview version. You can check it out and you can find Dr. Amol there, or you can find him on Twitter itself. And we'll be aiming for around the same time. We try to keep it as consistent as possible for our weekly podcast. We'll have another round next week. So thank you, Dr. Amol. Thank you, Judith. Thank you, listeners. Have a wonderful rest of your Friday. Cheers.
See you. Take care. Thank you.
Bye.
So, are we done?